Hello, friends. If you receive any Social Security benefit right now, retirement, disability, or survivor, there is a medical review process that affects your benefits. And in 2026, it has expanded significantly. Some of you will receive a letter from the Social Security Administration in the coming months that requires a response within 10 days. Others won't receive anything, but are walking past free health screenings every year that Medicare is paying for. And they have no idea. Today, we're covering all of it. Who needs to pay attention to SSA medical reviews? What happens if you ignore them? And then the part most people will actually find more useful, a free health benefit that every single Medicare recipient is entitled to every year, that most people have never used, and that starting this year includes a new test that could genuinely change your life. Before we get into it, subscribe to this channel right now and turn on the bell. I cover exactly this kind of information. Changes that affect your benefits and your health care in plain English before the deadlines pass and before the opportunities go unclaimed. Subscribe now and let's get into it. Let's start with the medical reviews, because the headline is real, just more specific than it might sound. The Social Security Administration conducts what are called continuing disability reviews, or CDRs. These are periodic medical evaluations to confirm that people receiving disability benefits, specifically SSDI and SSI, based on disability, still meet the medical criteria. This does not apply to retirement benefits. If you are collecting Social Security because you reached retirement age, CDRs do not affect your payments. Your retirement benefit is not subject to medical review, but if you or someone in your family receives disability benefits, SSDI or SSI, this matters significantly right now. In March 2026, SSA announced a major operational shift. It moved all CDR processing from state-level agencies to a centralized federal office called the Disability Case Review Unit. The practical effect is that the backlog of pending reviews is being worked through faster than before. SSA reported a 20% increase in CDR processing from 2024 to 2025, and that pace is continuing into 2026. More reviews are moving through the system. If you've been receiving disability benefits for several years and haven't had a review recently, there is a higher probability than in prior years that a CDR notice is coming. Here's what you need to know if that letter arrives. A CDR notice is not a termination of your benefits, it's a request for information. Typically a questionnaire called the Disability Update Report asking about your current medical treatment, any work activity, and changes in your condition. You respond to it. Provide current medical documentation, and SSA makes a determination. The critical number is 10 days. If your benefits are discontinued after a CDR and you want to appeal while continuing to receive payments during the appeal process, you must file that appeal within 10 business days of the termination notice. Miss that window and your payments stop immediately while you wait for a hearing. If you have been diagnosed with a condition that is permanent and unlikely to improve, a chronic illness, a condition where medical improvement is not expected, SSA generally schedules CDRs every 5 to 7 years, and your review is less likely to result in termination. If your condition was listed as likely to improve, reviews come every 6 to 18 months. The single most protective thing you can do if you receive disability benefits is maintain consistent medical treatment and keep records current. SSA's central question in every CDR is whether your condition has improved enough that you can now work. If your medical records show ongoing treatment, documented symptoms, and consistent care, that question is much harder to answer yes to. If there are gaps in treatment, months where you stop seeing doctors, SSA may interpret that as evidence of improvement, even if your actual condition is unchanged. Now, and I want you to stay with me here, because what I'm about to cover affects everyone on Medicare, not just disability recipients. There is a free health benefit that millions of seniors are leaving on the table every single year. Not because they can't access it, because nobody told them it was there. It's called the Medicare Annual Wellness Visit. It is 100% covered by Medicare Part B, zero copay, zero deductible, zero cost to you as long as your doctor accepts Medicare assignment, which most primary care physicians do. You can have one every 12 months, and here is the number that tells you how significant this is. Most Medicare recipients have never scheduled one. The annual wellness visit is not a physical exam. Your doctor won't be pressing on your abdomen or listening to your lungs the way a typical checkup works. What it is officially is a personalized prevention plan appointment. Your doctor reviews your complete health history, current medications, risk factors, and family history, and creates or updates a prevention plan specifically for you. They check your blood pressure, BMI, and other basic measurements. They evaluate fall risk, which for seniors is one of the most consequential health factors there is. They assess your functional ability in daily living. And they review depression and cognitive function. That last one, the cognitive screening, is worth its own moment. As of a study published June 1st of this year, Medicare is specifically required to assess cognitive function during the annual wellness visit. Your provider checks for signs of memory problems, impaired judgment, and difficulty concentrating. This is not a scary hour-long test. It's a brief, straightforward assessment, and it is included in the visit at no charge. The reason this matters so much is that early detection of cognitive decline. Catching the beginning signs of dementia before they become obvious opens doors to interventions, medications, and planning that simply aren't available once the condition has progressed significantly. Most people who need this screening the most are the ones who are least likely to ask for it. The annual wellness visit makes it automatic. To schedule your annual wellness visit, call your primary care doctor's office and specifically ask for the Medicare annual wellness visit by name. This is important. If you just ask for a checkup or an annual physical, the office may schedule a different type of appointment that does not have the same zero-cost coverage. Use the exact words, "I want to schedule my Medicare annual wellness visit." That terminology triggers the correct billing code and ensures Medicare covers it fully. If you have never had a Medicare annual wellness visit before, your first step is actually a slightly different appointment called the Welcome to Medicare Preventive Visit, which is available in your first 12 months of Part B coverage. If you've had Medicare for more than a year and have never done either, call and ask for the annual wellness visit. Your doctor's office will sort out which one applies. Beyond the wellness visit itself, Medicare covers a range of other preventive screenings at zero cost that most people also aren't using. Cardiovascular screenings for cholesterol, lipids, and triglycerides once every 5 years. Diabetes screening if you have risk factors twice per year. Colorectal cancer screening. Lung cancer screening for current or former heavy smokers between 50 and 77. Bone density screening for women. Depression screening once per year at no cost during any qualifying visit, and all vaccines recommended by the Advisory Committee on Immunization Practices, including shingles, pneumonia, flu, COVID, RSV covered at 100% under Medicare Part D or Part B depending on the vaccine with no cost to you. And one more addition that just took effect in 2026. Pharmacists can now administer tests and receive Medicare reimbursement for strep throat, influenza, and RSV. This was passed by the Ways and Means Committee in May 2026 and expands access significantly, particularly for seniors in rural areas where getting a same-day appointment with a doctor is difficult. You can now walk into a participating pharmacy, get tested, and have Medicare cover it. So, here is the full picture. If you receive disability benefits, be aware that CDR reviews are being processed more quickly in 2026. Keep your medical records current. Maintain consistent treatment. And if a CDR letter arrives, respond promptly and know the 10-day appeal window. If you receive any Medicare benefit, you have a free annual wellness visit available every 12 months that includes cognitive screening, fall risk evaluation, depression assessment, and personalized prevention planning. Call your doctor today and ask for it by name. And the range of free preventive screenings Medicare covers, cardiovascular, diabetes, cancer, depression, vaccines, is broader than most people realize, and now includes pharmacy-based testing for common respiratory illnesses starting in 2026. Subscribe. Share this with someone you know who is on Medicare or receiving disability benefits. Many people spend years paying attention to their physical health while overlooking another area that can be just as important: cognitive wellness. Memory, concentration, decision-making, and mental sharpness all play major roles in maintaining independence and quality of life. The challenge is that changes in these areas often happen gradually. A person may occasionally forget an appointment, misplace an item, or struggle to recall a name, and assume it is simply a normal part of aging. In many cases, it may be, but healthcare professionals understand that early awareness is valuable, which is why cognitive assessments have become an important part of preventive healthcare discussions. The purpose of these screenings is not to alarm people or suggest that every memory lapse is a sign of a serious condition. Instead, the goal is to identify potential concerns at an earlier stage. Early awareness allows individuals and families to ask questions, seek guidance, and make informed decisions about their future. In many situations, identifying a concern sooner rather than later provides more options and greater peace of mind. What surprises many Medicare beneficiaries is that cognitive assessments are often included as part of broader preventive care discussions. Rather than waiting until significant problems appear, healthcare providers may ask questions designed to evaluate memory, attention, and overall cognitive function. These assessments are typically simple and straightforward, yet they can provide valuable insight into a person's overall well-being. Another major focus of preventive healthcare involves fall prevention. While it may not receive as much public attention as heart disease or diabetes, falls remain one of the most significant health risks facing older adults. A single fall can result in injuries that affect mobility, independence, and daily life for months or even years. The reality is that many fall risks can be identified before an accident ever occurs. Balance issues, vision changes, medication side effects, muscle weakness, hazards around the home. All of these factors can increase the likelihood of a fall. The good news is that many risks can also be reduced once they are identified. That is why healthcare providers frequently discuss mobility, balance, and daily activities during preventive appointments. What makes this approach so effective is that it focuses on prevention rather than reaction. Instead of waiting for an injury to happen, healthcare professionals look for ways to reduce the chances of that injury occurring in the first place. Mental health is another area that deserves attention. Many people assume conversations about emotional well-being are only necessary when someone is experiencing a crisis. In reality, routine discussions about mood, stress, anxiety, and depression can play an important role in overall health. Feelings of isolation and loneliness can affect people at any age, but they can be especially challenging during retirement years. Changes in lifestyle, health conditions, family circumstances, and social connections can all influence emotional well-being. Preventive healthcare recognizes that mental health and physical health are closely connected. When healthcare providers discuss emotional wellness during preventive visits, they are not simply checking a box. They are helping create a more complete picture of a person's overall health. Sometimes these conversations identify concerns that may otherwise go unnoticed for years. Beyond wellness visits, Medicare beneficiaries may have access to a wide range of preventive screenings designed to identify health risks early. Cardiovascular screenings can help evaluate factors associated with heart health. Diabetes screenings may identify concerns before symptoms become severe. Cancer screenings can play an important role in early detection and treatment planning. Bone health evaluations may reveal issues that increase the risk of fractures and mobility problems. The common theme across all of these services is prevention. The earlier a potential problem is identified, the more opportunities exist to address it. This is one reason healthcare professionals consistently encourage people to stay informed about the benefits available through Medicare. Many beneficiaries are surprised to discover how extensive preventive coverage can be. Vaccinations represent another important area where misunderstanding often leads people to miss valuable protection. Some individuals assume vaccines are only important for children. Others believe they no longer need them because they have remained healthy for many years. Healthcare recommendations continue evolving because medical knowledge continues advancing. Vaccines designed to help protect against influenza, pneumonia, shingles, respiratory illnesses, and other conditions can reduce health risks significantly, especially among older adults. Yet countless people never ask what protections may be available to them. They assume someone will automatically tell them. Unfortunately, that assumption sometimes results in missed opportunities. One of the most valuable habits any Medicare beneficiary can develop is asking questions. Healthcare providers can explain which preventive services may apply to a person's unique circumstances and help them understand available options. Recent healthcare changes have also expanded access to certain services in ways that make care more convenient for many people. Access matters because even the most valuable benefit provides little help if people cannot easily use it. For individuals living in rural communities, transportation challenges and appointment availability have long created barriers to healthcare. Expanding access points and making services easier to obtain helps more people receive the care they need when they need it. Convenience may seem like a small factor, but it often determines whether people seek care at all. The easier a service is to access, the more likely individuals are to take advantage of it. When you look at the larger picture, an important lesson emerges. The disability review process and Medicare preventive services may appear unrelated, but they share a common theme: awareness. People who understand how these systems work are often better prepared to protect themselves. A disability beneficiary who understands review requirements is more likely to maintain documentation, respond promptly to requests, and avoid preventable delays. A Medicare beneficiary who understands preventive healthcare options is more likely to schedule important appointments, participate in screenings, and identify concerns before they become serious problems. Knowledge creates opportunities. Lack of information creates risk. Many Americans miss benefits, services, and protections not because they were unavailable, but because they never knew they existed. That is why staying informed matters so much. Pay attention to official notices. Keep important records organized. Ask questions when something is unclear. Review available benefits periodically. Small actions today can prevent larger problems tomorrow. For disability beneficiaries, maintaining ongoing medical documentation and remaining aware of review requirements can help ensure that important information is available when needed. For Medicare beneficiaries, learning about preventive services and discussing them with healthcare providers can support long-term health and well-being. Neither approach requires special expertise. Neither requires complicated planning. Both begin with a simple commitment to staying informed. The people who benefit most from these programs are often not those with the most resources. They are the people who understand how the programs work, pay attention to changes, and take action when opportunities become available. A single letter can contain information that deserves immediate attention. A single appointment can reveal a health concern before it becomes serious. A single conversation can help someone make a decision that improves their quality of life for years to come. That is why awareness is so valuable. Not everyone will face the same challenges. Not everyone will need the same services, but everyone benefits from understanding the programs designed to support them. If you receive Social Security disability benefits, stay organized, keep your medical records current, and respond promptly to official requests for information. If you are enrolled in Medicare, take time to learn about preventive healthcare opportunities and discuss available services with your healthcare provider. The most valuable benefits are often the ones people overlook simply because nobody explained them clearly. By staying informed, asking questions, and paying attention to available resources, you place yourself in the strongest possible position to protect both your health and your financial future. Share this information with family members, friends, caregivers, and anyone who may benefit from understanding these important programs. A simple conversation today could help someone avoid a costly mistake, discover an overlooked benefit, or take an important step toward a healthier future. USA Benefit Advisor.